If you or a loved one depends on mobile or specialized wound care, a critical deadline is approaching that you need to know about. Starting January 2026, Medicare plans to slash reimbursement for advanced skin substitutes by a staggering 90%. This isn't just a budget issue. Medical professionals warn this will cause treatment delays with devastating consequences. These delays dramatically raise the risk of infections, hospitalizations, and even preventable amputations. Next, we'll break down these changes, who is most at risk, and the steps you must take before the 2026 deadline. So, what are the specific new rules that will make advanced care so much more difficult to receive? First, Medicare will mandate a 4-week trial of standard care, and advanced treatment is covered only if the wound shrinks by 50%. This creates a dangerous catch-22. The most serious wounds can't improve that fast with standard care, forcing patients to fail first as their condition worsens. Second, Medicare is shrinking the list of approved advanced products, limiting a doctor's ability to pick the best treatment for a specific wound. Finally, providers will face a mountain of new paperwork to justify medical necessity, taking time away from direct patient care. These hurdles appear designed to restrict care. In a moment, you'll see exactly why Medicare is making these drastic changes. The official reason is cost. CMS notes spending on skin substitutes ballooned from $256 million to over $10 billion, citing potential fraud. But the solution, that 90% reimbursement cut, is a blunt instrument punishing patients and ethical providers. With such low payment, clinics may be forced to use cheaper, potentially less effective products. This actually makes it harder for patients to pass that 4-week trial, creating a cycle of treatment failure. The financial risk shifts to the providers. Clinicians will hesitate to use advanced treatments, fearing Medicare will deny the claim after the fact. This hesitation creates a dangerous chain reaction. How does it play out for patients on the ground? For mobile wound care, the impact is immediate. The new flat rate may not even cover travel costs, forcing them to shrink service areas. Many clinics, particularly in rural communities, may stop offering advanced care or close completely, creating wound care deserts. This loss of access leads directly to the treatment gaps and delays we warned about at the start. Manageable wounds miss their window for care. Without timely advanced intervention, these wounds can quickly worsen. They become larger, deeper, and infected. This is how we arrive at the worst-case scenario. Severe infections, sepsis, long hospital stays, and life-altering amputations that could have been prevented. You might think this is only a problem for people on traditional Medicare, but the impact is projected to be much wider. Historically, Medicare Advantage and commercial insurance plans follow Medicare's lead. These same restrictions could soon appear in private plans. These changes will disproportionately harm the most vulnerable: the elderly, rural populations, and patients with conditions like diabetes. And here is the ultimate irony. Could a policy designed to cut costs actually end up costing Medicare more money in the long run? Adding to the problem, the future of telemedicine coverage is also uncertain, potentially removing another lifeline for remote patients. The answer is almost certainly yes. Medical economists argue this policy is penny-wise and pound-foolish. Consider this. The cost to treat an amputation or sepsis is vastly higher than early wound care. By restricting initial treatment, Medicare creates bigger bills later. This financial burden also shifts to you, the patient. Reduced coverage will likely mean higher out-of-pocket costs for supplies and treatments. We've seen the rules, the risks, and the hidden costs. With the clock ticking, what is the single most vital action you can take? The deadline is January 1, 2026. After this date, the new, more restrictive rules are activated. Right now, under the current system, you have broader and more direct access to the advanced care you need, without these new barriers. That is why patient advocates are sending a clear message. If you have a non-healing wound, seek evaluation and treatment now, before these changes take effect. Don't wait for your options to be restricted. Take control of your health. Schedule an appointment and secure the care you need while you still can.